So I'm not going to read this because I assume that you all know how to read. So the Health and Social Behavior Master's Program is really just training scholars and practitioners to identify the major social, cultural, and biobehavior determinants of health and health behavior, and essentially to kind of improve communities and population health. So to get more specific in how we do that, I want to talk a little bit about our faculty. As you can see, there's many different faces. And what's really cool about HSB is that a lot of these folks hold multiple faculty positions across schools. So, for example, we have Jason Corburn, who's with public health, but also with city planning. We have Lori Dorfman, who's also with us, but with journalism. Obasagi is also with us, but also with law. Ann Keller also, with public health management, policy and management. So as you can see, a lot of our faculty is very interdisciplinary, which is something that I like to say about health and social behavior. As the MPH program, we very, very much encourage our students to be interdisciplinary. So if you're interested in talking about any of these faculty, please let me know. These slides are going to be shared, right? Great. So very quickly about the curriculum, and this won't apply until you're in the program, but just to kind of give you a very general overview, there's a difference between the Berkeley school-wide requirements, which all students have to take, and then the HSB required courses. So we have our first year seminar, which is really about building community, kind of setting you up, intro to being a master's student. And then you have your theories of health and social behavior. Program planning and evaluation are two very important classes and important skills that students get from those classes. We also have research methods, health, race, equity, health, race, ethnicity, and social inequities. And then we have HSB electives. So that being said, what happens when you take these classes? What do we hope that you learn? Again, not going to read these things, but just a couple of points. As I mentioned, program and evaluation is a really important class. So the skills that you take away is evaluating whether or not community interventions or programs or policies are actually effective and if they're helping the people in the community. Another one is kind of identifying ethical challenges and principles when implementing and evaluating public health programs. So with HSB, you really kind of get both theory and practice in regards to supporting whatever community that you're interested in. So I know a lot of folks are really interested in kind of acceptance percentages or data. So I have some here. As you can see, this cycle or this past cycle, we had 80 MPH applicants. We have 3 concurrent programs, which are programs which you can earn 2 master's degree in the span of 3 years. So we have social welfare, MSW, city planning, MCP, and journalism, MJ. And as you could see, we had about 15 applications, 16 and 4. And you could see the percentage acceptance rates down there, as well as the breakdown of kind of URMs and first gens. And HSB really prides themselves in kind of the URM and first gen pool there. Another thing that I want to highlight is the young applicants. So HSB has a requirement of having worked 2 years of full-time related public health work. So it is very much encouraged, just because, as I mentioned, the program really emphasizes on both theory and practice. So our current cohort, as of now, we have, this is also including our incoming students. So we have 27 HSB MPH students. We have 6 MSW, 4 MCP, and 1 journalism. As you can see, journalism is not as popular, but it is a really great program. Cool. Another really important thing that students want to know about when applying to these programs is what happens with kind of work experience. So on top of the 2-year work requirement that we have our practicum requirement, which is really great because you can kind of decide what works and what doesn't work for you. So as you can see, the requirement is 10 full weeks over 400 hours. It's over the summer between your first and second year. And there is a wide range of organizations that our students have been involved in, just because, as I mentioned, the interdisciplinary nature of HSB. So we even have some students in different countries, Ministry of Health and Labor in Japan, CDT in Africa, yep, all the way to consulting to Deloitte, and then even smaller kind of community-based organizations such as Asian Pacific Institute and La Clinica, which is in the Bay Area, and then of course, as you see, lots of students stick around in the UC system. To kind of go off on employment, post-grad data. So many of our students go to nonprofits, whether it's domestic here or international. 19% goes to government. That's a really popular one, whether it's local or state or federal. And then healthcare systems, so kind of hospitals, and then 13% private and 4% self-employed. So the average salary, and this is among the graduating class of 2023, is about 82,000, and some of the sample title jobs that they've held are the program planner evaluation, which I've talked about, and consultant, and strategic community fellows, which are just some examples of the titles that people have. So this is, again, 2003. If you're interested in kind of previous ones, please let me know. I'm happy to gather that data for you. And just to kind of highlight on top of what Derek mentioned, the different supports that are available to our students. For HSB specifically, you will be paired with a HSB faculty, so that person will be your academic advisor. And you will also get paired with HSB continuing students so that you really understand, adjusting and the experience of being a student. And lastly, you have access to me, HSB program manager, where I do a lot of support for advising on your classes, degree assessment, and just kind of overall support for the time that you're here.